Are you curious about refractive surgery like LASIK, PRK? Do you want to know if you're a good candidate, what the pros and cons are? That's what we're going to talk about on today's video. I'm Dr. James Thirion with the Eye Doctor Near Me channel, where we talk about vision-related products, and eye care. If you haven't already hit the subscribe button, make sure to do that now. Patients ask me every day if they are a good candidate for refractive surgery. And most of the time the answer is yes. It is pretty rare that we can't find a refractive surgery structure that doesn't fit a patient's need and desire. And so I'm going to talk quite a bit about the different versions of refractive surgery and pros and cons to which one, and at the very end I'll tell you which one I actually had done on myself. So which version of refractive surgery boils down to two different things. One, how thick your cornea is, and two, what your glasses prescription is. When it comes to refractive surgery, there's a handful of different ways we can do it. One of the older versions, RK, is not being done anymore in the US, and if you're trying to travel or if you're watching this video in another country and they're talking about doing RK, you definitely want to stay away from that. Basically with RK, what they do, and it was absolutely a brilliant idea with the individual that came up with it, but basically they'll make incisions kind of like spokes on a bicycle, and depending on how deep they go with that incision, it would elevate the tissue and adjust our prescription. And what we learned several years after doing RK surgery on a lot of people is that one, scar tissue continues to change. So individuals would end up with this really different prescription. The second thing we learned is that we just created these high and low valleys all along the edge of the eye. And so as their prescription or as their eye would dry out, it would adjust their glasses prescription constantly. So a lot of my RK patients that had it 10, 15, 20 years ago kind of deal, I have to talk to them about here's a different pair of glasses for morning, here's one for afternoon, here's one for evening, here's one if it's sunny and hadn't rained in a week, and here's a pair of glasses in the event that it's been raining every day for the last week. Now there are new things that we can do, like large diameter contact lenses. LASIK is the most common performed refractive surgery in the US. And the way it works is we have 5 layers to our cornea. They use a femtosecond laser to create a flap out of the first 2 layers, use an excimer laser to basically cut your prescription in. Now, normal parameters to have LASIK surgery done from a glasses prescription standpoint is +6 to -10 for your sphere power, and then -6 on the cylinder. And so what that means is if you're looking at your glasses prescription, you'll see either 1, 3, or 4 numbers for each eye. The first number is going to be your sphere power. The second number, if there is one there, is going to be your cylinder power. The third number, if there is one there, is going to be an axis of the location of the cylinder. And the fourth number will be a bifocal or an add power if you have one. So for the most part, ignore the add, ignore the axis, and just look at the sphere power and the cylinder power. If that sphere power is within a +6 and a -10, you should be a good candidate for LASIK. If the cyl power is between 0 and -6, you should be a good candidate for LASIK. The wild card on all of that is how thick your cornea is. So basically what they do is they create a flap out of the first 2 layers with a femtosecond laser. Then they use an excimer laser to cut your prescription in. If they have to go too deep or cut away too much tissue, they won't do it. It's not safe because you could end up needing a corneal transplant or something along those lines down the future. So they will look at how thick your cornea is in comparison to your prescription. So with that cornea, they want to leave at least 300 microns of thickness to it, and they won't want to do the surgery if your cornea is less than 500 microns thick to begin with. And so that's the one caveat to whether or not you will be a good candidate for LASIK or not. If your prescription is within the parameters I just talked about, then it comes down to, is your cornea thick enough to handle? What would you expect eye drop wise? So typically before surgery, they'll give an antibiotic eye drop that they want you to use. Normally they'll want you to use it 4 times a day for about 2 or 3 days before you start surgery. Now after surgery, they're gonna keep you on that same antibiotic eye drop, and they're gonna want you to continue using it 4 times a day for another 5 days afterwards. So you'll be on that eye drop for about a week's time in total, doing it 4 times a day. After surgery, They're also going to give you a steroid eye drop to try to calm inflammation down and chill things out. That drop, again, is probably going to be prescribed for use 4 times a day for about a week. The other thing that you're going to want is you're going to want to use some good artificial tears. And so the artificial tears, you're going to probably want to use about every hour while you're awake for the first month, every 2 hours while you're awake for that second month, and then every 3 hours you're awake for the third month. And so you'll use those artificial tears for quite a long time. And so you're gonna wanna make sure to get some that are preservative free. Now, if you're not a good candidate for LASIK, you might be a good candidate for PRK. And I know it's gonna sound weird because the first thing I'm gonna tell you is the parameters prescription-wise for PRK. PRK's parameters for the sphere power is +2 to -10, and then a -6 on the cylinder power. And that is less in the parameters on the plus side than LASIK is. So the laser that they use for PRK is the exact same laser that they use for LASIK. The real difference is instead of having that flap created out of the first 2 layers, they actually burn the epithelium off before they cut your prescription in. And so because of that, they don't have to have all this extra tissue wasted in a flap going over and back. That is why a lot of times they can get an extended range for people that can't qualify for LASIK into having PRK. With PRK, they need that minimum thickness to be about 450 microns. Remember with LASIK, it was 500, so this gets down to 450. Now the average corneal thickness is about 550 microns. So the average individual has more than enough tissue to do either one of these 2 procedures. So when it comes to eye drops before PRK, they're gonna put you on an antibiotic to use 4 times a day for 2 days, and they're probably gonna actually do it in 2 different drop versions. They're gonna get rid of a little bit more of the bacteria, cover a little bit wider area, and the reason why is, remember, you don't have any epithelium, no skin tissue there on the front part of the cornea to try to help out and protect from infections. So they want to be extra cautious and have a little bit extra coverage. Now, after the procedure, they will want you to stay on both of those antibiotics, still doing them 4 times a day for about a full week afterwards. Now, they are also going to put you on a steroid eye drop to use after surgery. They're going to want you to do it 4 times a day for about 7 days, then 3 times a day for about 7 days, then 2 times a day for about 7 days, and then 1 time a day for about 7 days. They are also going to probably put you on a non-steroidal anti-inflammatory drop, like a Tylenol type deal for the eyes as well. And they're going to want you to do that drop 4 times a day for about 7 days after the surgery. Now they may put you on a stronger NSAID, and then they would maybe only want you to do it twice a day. So you'll want to listen to your surgeon on how to use the eye drops. After surgery, they're going to put a bandage contact lens over your eye that'll help decrease the pain a little bit. So what are the pros and cons to LASIK versus PRK? So with LASIK, one of the pros is you'll sit up from the table. It'll feel like you've been out in the sun a little bit too much, but you will see great. There's really no recovery time needed. You also have less drops to mess with, less pain, and a lower risk of infection. The cons to LASIK is that you do have a flap. So if you like to MMA fight, skydive, water ski, snow ski, or do any type of activity that you could get hit in the face or in the eye on a regular basis, that flap could get dislodged and LASIK may not be the ideal situation for you. So the pros and cons to PRK are: 1, it is significantly more painful than LASIK. 2, there's a higher risk of infection. 3, there's a slower recovery time. It takes a couple of months before you're back 100% vision-wise. Granted, you're seeing pretty good after a couple weeks, but it could take a full 2 months. You also have more eye drops you've got to do, a higher risk of infection. Now, the pro to PRK is it may be the only surgery you're capable of doing if you don't qualify for LASIK. The other pro is there's no flap. The epithelium all grows back on its own. There is no flap, and so if you wanted to MMA fight, skydive, water ski, you don't ever have to worry about that flap getting dislodged. Now, LASIK and PRK, they pretty much cost the exact same thing, So it all boils down to which procedure would you rather have? And do you qualify for both, or do you only qualify for one? Now, the ICL procedure was created for individuals that can't have PRK or LASIK. With the ICL procedure, we still have the same cornea, but they'll make an incision and stick a lens that'll hang out in the front part of the eye a little bit. And so they don't have to change that lens ever. It just hangs out there for pretty much all of eternity. Now, if your prescription ever changes, they can pull that lens back out and plug a new one in. Now, this is a little bit more invasive procedure, so there's a little bit higher risk of infection, but otherwise it's a really good procedure, and it doesn't matter how thick your cornea is because we've bypassed it. Now, the ICL procedure is typically more expensive than LASIK or PRK. I had PRK done. Now, I was on the border between having PRK and LASIK. I could have had either one, but I chose personally to have PRK because, one, I think it's a better procedure because instead of the surgeon flattening that flap, I let my own body re-heal that epithelium over top of it. And so I do think it's a better procedure. I also got it because I do want to skydive. I do enjoy water skiing, snow skiing. I'm okay, not MMA fighting, but I'm okay roughhousing with my kids and that kind of stuff. And so because of those things, I wanted to not have a flap. And so those are the reasons why I chose to have PRK instead of LASIK. Now, having said that, my mom had LASIK, my sister had LASIK, my brother-in-law had LASIK, and my wife will have LASIK in the future. And so don't hear from me that LASIK is a bad procedure, because it's not. Because if it was, I wouldn't have let those individuals have that procedure done. But I do think PRK is better. But remember, it has a slower recovery. It's fairly painful for a few days, maybe a week. And then it takes at least a month, maybe two, to get that good crisp vision from it. I get asked all the time by patients that need bifocals if they are still a candidate for LASIK or PRK or refractive surgery. The answer is yes, you are still definitely a candidate, but there's a little bit of a caveat going on. So whenever it comes to the procedure, they can set you up one of two different ways. They can set you up perfect for distance, and you would have to pick up over-the-counter readers or some type of reading glasses. And so both eyes look great off in the distance. Can't see very well up close, but that's where those over-the-counter readers kind of come into play. The other thing that they could do is what's called monovision. With monovision, they set one eye up for distance, one eye for up close, and the brain learns which one to kind of seesaw between. And so I always tell my patients, before you have monovision done permanently with refractive surgery, try it out in contact lenses for a couple of days, maybe a week. Because monovision tends to have about a 50 to 60% success rate in my clinic, and we don't want to have you go do something surgically that you have a 40 to 50% chance of disliking. And so try it out in contact lenses first, make sure you like it, then go and have that surgery done. What can you expect during the procedure? So you'll sit in the waiting area a whole lot longer than anything else. They'll walk you in, lay you down on the surgical table, and you'll look up at that laser. The procedure, it takes maybe a minute or two per eye, but the main thing you'll notice is it'll smell kind of like your hair's on fire. That's about the only sensation. Then they'll flip that flap back over, and then they'll do the other eye. Once they've done both eyes, you'll pretty much exit the building. The procedure itself is not painful at all. So now if you are gonna have refractive surgery, there's a few medications you wanna stop before the surgery. Accutane, for instance, you're going to want to be off for at least 1 month before you have refractive surgery. Imitrex, you're going to want to be off for 1 week before and 1 week after. And then nasal steroids for like allergies, you're going to want to be off for at least 5 days. For oral steroids, you're going to want to be off for at least 1 month. And for topical steroids, you're going to want to be off for at least 3 days. So there are also some conditions that you don't want to have surgery with. If you have EBMD, you're only going to want to do PRK. Recurrent corneal erosion, you're going to only want to do PRK, not LASIK. If you have glaucoma, macular degeneration, cataracts, diabetic retinopathy, herpes simplex viruses going on, if you have keratoconus, pellucid marginal degeneration, if you need prism in your glasses, those things you are not going to want to have refractive surgery with. You want to be out of soft contact lenses for at least 1 week. So hard contact lenses, you're going to want to be out for at least 6 weeks, possibly longer. If you've worn the hard contact lenses for more than 20 years, you may need to be out of them for 3 or 4 months before you rock and roll with refractive surgery.